Hey, everybody, welcome to the Green Cover Podcast, where we have really interesting conversations with some of the top agricultural producers and experts in the regenerative ag movement. Join us as we learn together how we can regenerate God's creation for future generations. We're going to take just a little bit of a different tack today. Instead of just talking specifically about soil health, we're going to be talking a lot about human health and how the two tie together. And if you've been watching the news or listening at all, you know that we've got a huge health crisis here in America. We spend more per capita than any other country in the world on healthcare, to over $12,000 per person. We spend over $4.3 trillion as a country on healthcare, and that is just a huge amount. 93% of Medicare claims all relate back to chronic disease, and diabetes is 10 times more prevalent than it was back in the 1960s. And today we have a guest who knows these statistics all too well and is doing some really cool things to come up with very creative, very regenerative solutions to some of these problems. So, welcome, Erin Martin. Erin is a friend of ours. Erin, we've known you for quite a while now. You are the founder of Fresh RX Oklahoma, a clinical gerontologist, and just really kind of a regen ag superstar anymore. So, thank you for joining us.
Thanks, Keith. Yeah, it's been great to know you and know your work and to work together and with all the other rock stars too. So we need as many as we can get, right?
For sure, for sure. So it's been a lot of fun. So a lot of people probably don't even know what a gerontologist is. So give us
Yeah,
just a
no,
little bit
they
of background. Give us a little bit of your education, your work background, and then we'll kind of
yeah.
dig into some of the really cool things that are going on.
Yeah, so baby boomers, a lot of people know what baby boomers are. That was my parents' generation, and it was the biggest generation and that is aging in this country today. And so, gerontology and gerontology schools were born kind of expecting this problem that 10,000 baby boomers are turning 65 every single day. And they're actually on an average of 15 or more prescription drugs per year. And they have multiple chronic conditions. And it's costing our healthcare system, like you just mentioned, a lot of money. And we're in
Yes.
trouble because of that. And so, gerontology is about the aging process. And gerontologists go into all different kinds of fields. They go into policy making, they go into advocacy. I went through a track where I was being trained to be a nursing home administrator or an assisted living type administrator. And during that time in my program, I was learning a lot about what natural processes of aging is and how that was actually different than what I was seeing in the United States. And so I was director of social services over 7 affordable housing sites for seniors. And I was learning, all of us gerontologists learn the physiological changes of aging, like what is a natural, what are things that people experience, psychologically, what they experience as they age, lots of loneliness, lots of loss as you get older, and just experiencing life is challenging. And then we also learn about different cultures and how they respond to aging. And it's really a social work based field, but there's also medical professionals like geriatricians who are MDs but focus on older adults. They'll come over to the gerontology school and get some additional learnings. Like something that a lot of people wouldn't know is when a regular doctor takes your temperature, in a young person, it's 98.6. But in older people, it may be different, and you have to know those types of things. So there are a
Hmm.
lot of differences in the bodies and as they age. But I was learning about, like, what does it take to have a healthy life and have longevity, and I was putting those pieces together at that time. So I actually started working in a retirement community when I was 15 years old. And by the time I was in my mid 20s, I had worked in all levels of long term care, including hospice care. And so I'd really seen the systems of aging and how challenging it was for adult children of older adults to navigate those things. And I was
Yeah.
trained on Medicare and Medicaid and Social Security by lawyers and really understanding those systems and how to help and empower people to navigate those systems. But I was seeing them, all these things, as band-aids on a much bigger problem with chronic disease. And that's kind of where I went from there.
Yeah. Well, that's a great background, and just for the record, I am 41 days from being a baby boomer. I was so I'm Gen X, but barely.
Yeah.
So yeah, that's those are those old people, not me,
Yeah.
right?
Right.
But so I mean, a fascinating background and great experiences. But how did you get from there to where you've been really immersed in the regenerative ag world? And I want you to talk a little bit about your Fresh RX program in Tulsa there, because that's just such a cool story, and I think it's a great model for other people to follow and set up, hopefully. So, how did you kind of make that transition over to where you find yourself now?
It's amazing God's journey that he puts us on. And when you look back, you realize how intentional the path was, and but you don't know it in the moment. One of the things I started really changing my own diet and my lifestyle as I was learning more about the aging process in school. I started really cleaning up my diet, and I saw changes in myself, and I was actually able to come off some prescription drugs as well during that time. And I was learning about herbal medicine and different medicines all over the world that God created. And I started learning about something called the blue zones, where people age the
Yeah.
longest in the world. It's the largest concentrations in the world. There's about six of them. There's some other quasi blue zones that people will speak of, but mainly six that were identified by Dan Buettner in the Blue Zone book, and now a series on Netflix. And these areas where they have the most 100-year-olds in the world, and what those things had in common. They had a lot in common. One of the things, although they were very different cultures, they had herbal medicine they used, they ate a lot of local food, they had very close knit communities, and they lived intergenerationally. I think they had a sense of purpose, which people could call spirituality or purpose, God's plan, however you want to describe
Hmm.
that. They had some sense of that, which is this deep, I think, a deep hole in a lot of people who haven't figured out what that is for them.
Yeah.
And so that kind of aids in probably better mental health, and emotional health as well. And they had a very plant forward diet, but mostly like whole foods. They're not eating like at McDonald's every day and that kind of
Yeah.
thing.
And weren't
And
they active in growing a lot of their own food as well?
yeah, yeah, and active in general. So a
Yeah.
lot more walking in their communities. There were older people living with like five generations of their families. So
Hmm.
lots of support and love and community as well. And yes, many of them would grow their own food or probably process a lot of their own food, and probably are eating a lot of locally grown food right there in their community. So it's going to be super fresh. It's not large scale ag, so it's probably going to be more nutrient dense. And we're going to get into some of that.
Hmm.
So I was connecting food as medicine at that time, but I never connected it, which is all ironic, to agriculture. And randomly, I had a mutual friend who was the executive director of Kiss the Ground in Los Angeles at the time, because that's where I was getting my master's at USC. And I was just kind of admired her work. She had started this community garden in Venice Beach, and just doing some, local food type stuff. And they had this new certificate program on soil advocacy, and I was just kind of curious. And I said, "Hey, can you get me in this little course?" And I was starting to read. There was a lot of reading, a lot of research, a lot of books, and it was very foreign to me. But I started reading soil science. I never thought about agriculture. I grew up in cities. None of my family members were in farming. I never really gave it a lot of thought, which is probably a lot of people in
Yeah.
metropolitan areas. They're not connected to it. We're super detached. Our food is comes from a package in a grocery store, right?
Right.
Uh, that's where it comes from. We're detached both from food and farming and our own health, and detached from each other, I think, in a lot of ways too. And so there's a lot of detachment going on. And so I started reconnecting these dots in the synapse in, I think, my brain and a lot of other people's brain that's been utterly destroyed. And so it's all ironic that I didn't think food was connected to soil health, but how could it not be if it's growing there?
Right.
And I was shocked by how much our food has been depleted in particularly micronutrients, vitamins, minerals, phytonutrients over the last like 50 to 100 years.
Mhm.
But so I was connecting like, oh, well, that must have to do with some of this chronic disease. If we're I already knew that when you're depleted of vitamins and minerals, your body is going to not be able to heal itself. And so you're going to get chronic disease. So I kind of already understood this idea about health and aging. And so when I started learning that, it connected all these dots for me. And then I was like, wow, aging or healthy aging might actually start in the soil.
Mm.
And what gave me hope was like, this is a horrible, like, I'm seeing long term care. We are our bodies are being destroyed, our healthcare system's collapsing. Like, not a lot of hope here, you know.
Kind of
Uh,
discouraging. Yeah.
Very discouraging. And but this gave me hope for the first time. And when I learned about regenerative agriculture and the ripple effect of benefits on the climate, animal health, plant health, human health, that we could actually regenerate the nutrients that we've lost in the way we've farmed, but we could actually increase it. I'm just thinking, wow, this could be the answer for everything. And that's when all those dots connected. And it
Mm-hmm.
was like a light bulb. It's not even one light bulb. It was like 40 light bulbs going off, just, yeah,
Yeah.
just crazy. And God's been chipping away at me for this time, putting me through fires, forging me, and getting me aligned to this idea. And it changed
Because
my
how
life.
long ago was this? It wasn't that long
Yep.
ago, right?
This was in 2017. So,
Okay. Yeah.
yes, not all that long ago, only about 8 years ago. And Fresh RX wasn't even a star in my eye, a twinkle in
Hmm.
my eye. And I moved back to Tulsa. I had another God thing, Keith. So, I had two really big moments where, because I had grown up in Tulsa, Oklahoma, actually a
Okay.
suburb of Tulsa. Um, More of a sod farming kind of area, which was really foreign to me. Um, but I wanted to get out. It was like a typical, young person want to get out in the world and experience new things. So I moved out to Los Angeles and done all that and gone to school and working and doing this whole thing. And I got the another lightning bulb moments of calling me back to work in Oklahoma. And I had sworn, I am
Never
no
coming back.
way,
Yeah.
not coming back. No way. And my best friend at the time, still my best friend today, she said, Erin, if all the good people move away from Oklahoma, what happens to Oklahoma? Was like, wow, that's a really good point.
Hmm.
And I had some other lightning bulb type moments. It took a couple to get me to consider it. And I begrudgingly moved back to Tulsa, begrudgingly. And it's amazing to say now, it was the best thing that ever happened in my life. It helped me launch a culmination of all of these teachings and learnings and to really create community and doing that through the Fresh Arts program. And so, kind of how that happened is uh, I moved back in 2019, right before the pandemic. So, I had had a couple of years, 2017. I started helping families navigate long term care, but also with what I would say a holistic flair. And I was teaching them, eat better and do these types of things. And I was seeing clients have great success. And the pandemic hit. I moved back to Tulsa, still serving clients, still speaking publicly about these things. But the pandemic hits and I can't really speak publicly, can't really go into long term care and serve people. So I had a lot of free time. And certainly the food system, there's many cracks in our society, and COVID highlighted lots of those things.
Yes, it did.
Yes. And one of those things was how fragile our food system is. And uh, that felt like a very immediate need for people. And so I was out volunteering. when there was the farm to family food boxes that were being given out. I was working with local nonprofits, just volunteering, like seeing what's going on. And then I was meeting with young people on farms and people thinking about, we need to grow
Mhm.
our own food. Let's solve this problem. And there was a lot of iterations of that, lots of different groups. And I started really honing in, and God is, moving me through here. And I met a doctor in North Tulsa. And North Tulsa was a food desert, still very much a food desert. Didn't have a grocery store for 14 years,
Mm.
very low income area, high rates of mortality from diabetes. And there was a lot of attention on this area in Tulsa because it was very much so underserved and has been for a very long time. In fact, a 10 to 11 year longevity difference between
Wow.
North and South Tulsa, which clearly piques my interest as a gerontologist in
Yeah.
the disparity there and why that is. And it was really just about access to healthy food, and other types of resources. And so this doctor said, Erin, my patients are coming to the doctor, they're taking their medications, but they're diabetic and they're getting worse. And their A1C level, which is how you measure where people are in their diabetes, it's just skyrocketing. It's super high. They're at risk for having kidney failure, stroke,
Yeah.
amputation, and we've got to do something about this. And I totally agreed. And he said, help me raise money to do this. And I said, okay, I have some free time during the pandemic. And man, I raised $185,000 over 4 months on Zoom with funders. And we literally started in a parking lot. And we couldn't do in person classes at the time. So we did food and education for people.
Mhm.
And I said, well, there was kind of a community committee with the doctor, and they were kind of putting the pieces together of this program. And they said, okay, well, we'll order the food from Walmart or Amazon. Well, in
Mm.
2017, this would have been just 3 years, about 3 years prior, when all those light bulbs came off. And I had this in my back pocket. I said, no, farmers using good soil health practices, local, local economy, good farmers that really
Right.
care. Those are the people that we want to source this food from, because if we have any chance of getting people to eat fruits and vegetables, let's keep it the most nutrient dense, beautiful food that these farmers deserve to be honored and to be a part of this process, to be recognized as what I call farmers being the longevity heroes, because so much of what they do is predicting kind of the health of people. I mean, there's a lot more steps involved with that. People have to choose to eat it, but it's the sweat and blood and tears of farmers that is very under recognized, and I wanted them to be a part of this program. And people said it would be really unlikely, Erin, that you would be able to do that, right? With just our current system, uh, it wouldn't be an easy feat. And I definitely am someone who likes a challenge. So I said, I'm only going to source from local regenerative
Sure.
farmers.
Yeah, and it's also important because that nutrient density is so closely tied to taste and to
Right.
smell. And nobody wants to eat vegetables that are just blah or bland. And so, you've got a much better chance of, getting these flavorful, aromatic
Yes.
vegetables into people's diets, not to mention that they're going to be far healthier for that as well.
Yeah.
So we can count this as one good thing that came out of COVID, I guess, because this
Yeah.
Fresh RX really was kind of birthed out of that.
It
There's
was.
not a lot
It
of good
was.
things that came out, but we'll count this
Yep.
as one. So from those humble beginnings, how has it grown?
It's grown drastically. We've quadrupled in size. We went from that one clinic. We had one clinic mostly, and then we had a couple from another clinic initially. So basically, two clinics. And we've grown to getting referrals from over 22 primary care clinics in Tulsa across 6 health systems. We've navigated lots of challenges, but it's been actually the path of least resistance in my life. And it's very clear that God has opened every door possible that needed to be, and shut doors that
Mhm.
we didn't need to go in. And really, being a part of the regenerative world and who've appreciated and recognized this work has really launched us in so many ways. And being able to speak across the country about soil health and human health and really use FreshRx as this case study. We have had incredible health outcomes. I could tell you so many stories about people transforming their health. We've had people come in the program suicidal and not be suicidal anymore. We've had people come into the program legally blind and leave not legally blind anymore because diabetes really affects the eyes. We have had people fully reverse their chronic diseases. We've had people go into remission of cancer in our program. We've had people
Mhm.
come off all of their prescription drugs or considerably decrease their dependency on prescription drugs. And it's been an incredible thing to watch. The doctors want to be a part of this, the farmers feeling reinvigorated, appreciated, having a diversified market to sell to, and to see the patients embody these things that I always knew was possible, but that they made the choices inevitably
Mhm.
to do that. And from the very beginning, I knew just doing this on grant dollars was not going to be sustainable and that this really deserved to be a recognized healthcare intervention. But I knew that um, that's a pretty controversial topic, or it has
Yeah.
been in the past. But I think there's been some changes that have been made that have kind of opened the doors in the last 5 years. And even in the administration now, there's this alignment that I don't think we've ever seen before. That the
Yeah.
topic about our food system has not really been a mainstream conversation. And so now it's given some validity to that. And so we are actually, all the stars aligned again. On May 1st, we passed the Food as Medicine Act of Oklahoma, which requires the insurance companies that cover the folks on state Medicaid, so low income folks, which a lot of people think that population doesn't want to change or get healthy. And I can tell you from experience, it's very untrue. They
Mhm.
just need the resources and to be taught. And then, just like everybody else, that they want to be healthy, they want to feel good. And so um, we're working with the state to implement that. We have lots of support, but we're excited to see Oklahoma implement this well. We also included a requirement for local food, or at least a prioritization of local food sourcing. We want to stimulate local economy on the back of food as medicine. I think that's something we can do nationally. There's lots of groups in the nation that do these types of programs that also source local food. There's also a really good friend of mine, Dr. Stephen Chin in California, who runs a program, and he only sources regenerative food as well. So him and I very much echo each other. So, and he does it, he's like us on steroids. We've served about 500 patients. He's served 5,000 with
Wow.
regenerative ag. And I think these two movements coming together and being aware of each other makes us more powerful.
Yeah, that's wonderful. And I want to go back just a little bit because I
Yeah.
want to make sure people don't miss this, that Fresh RX and now the food as medicine policy, you're funding this through the insurance companies. And that's to me that's just stunning. I mean, it's the way it should be because food as medicine, they're paying for medicine, but
Yeah.
the insurance company, so doctors are writing prescriptions, insurance companies are paying for it, and that's how you're driving this forward. And that's just again, a few years ago would have been almost unthinkable.
It is. And the reason why they're really interested in doing this, obviously because there's a need, but because it actually drives cost savings.
Yeah.
And
Yeah.
that's really important. Obviously, we spend way too much money. Like you were saying earlier, we spend more money on the cost of poor nutrition than we do our military. And a lot of the food we're growing, we have all these food deserts, which we have agriculture everywhere, but we have food deserts and people sick. So it doesn't make sense. And the the cost savings are huge for this. We could save the country billions of dollars on healthcare costs. But basically, with diabetes, we have seen that we almost have like a 5 times ROI, return on investment. And That is really what ultimately is driving insurances to want to pay for this, because they get paid a capitation rate per person. And if they don't spend all that, they get to keep it. So our argument is that food as medicine programs should share in those cost savings, and that it should go back into the community. And ultimately, I think the farmers should be paid dividends on these health outcomes. And that really creates this circular economy that just goes back into incentivizing farmers to grow healthy, nutrient dense food. And then we know the ripple effect of the impact on the environment and everything else, our water, and how that can happen. So insurance is doing this all over the country. They're thinking about it. They have some different programs are in commercial, Medicare Advantage, and Medicaid. There's 20 something states that are doing this at a Medicaid level. And our hope is that this would be federalized, particularly within this administration, to make this like open sesame. Every insurance is going to cover it if you've got a chronic disease. And maybe even you can use your HSA dollars to pay
Yeah.
for food and regenerative food, which you can actually. It's starting to happen. So we're really excited to see where this can go nationally. And regenerative agriculture folks need to be at these tables discussing
Yeah.
this. And we want more medical professionals to understand the difference between like food in a grocery store, food at a food bank, and food grown at a local regenerative farm, and maybe why they would want to prescribe that over something else, right?
Yeah, and again, it just can't be overstated how important that is that the insurance companies are getting on board, not because they're altruistic, and it's
Yeah.
because it's to their financial advantage as
Yeah.
well, which just proves the point that this is working and it's a win for all the folks involved.
Yeah.
I want to go back to the farmer side of this a little bit. So
Mm-hmm.
as you were starting Fresh RX, was it difficult to find farmers growing, this because it's mostly fruits and vegetables, I'm
Mm-hmm.
assuming, right? Was it
Yes.
difficult to find them, and have you seen more people enter into this production space because of what you've done?
It's been a very interesting journey. I really turned over stones, but I don't know if God brought me back to Tulsa also because we had a lot of just had these young people in Tulsa who had quit their 9 to 5 jobs to become regenerative farmers. So I was super lucky. At first, I had a smaller group of farmers, and I would buy everything they had available. So I
Hmm.
started at the farmers market. I found several farmers there that use regenerative practices. I had to ask certain questions to actually, because
Yep.
they may not even identify as that.
Hmm.
And then I got word of mouth through other farmers. Farmers know other farmers that may not be selling at the farmers market, but maybe they have a CSA or they've got other stuff going on. So I built a good net, really core group of about 15 farmers. We've served about 27 small scale producers, and more people also have entered into using more regenerative practices or just starting new farms. Lots of new and beginning folks, families that just wanted to grow healthy food for their own family because they realized that they needed to do that for their family, that maybe want to sell a little bit extra of their food. And so we really started by aggregating a lot of similar products, but from different farmers to get the amount for 50 or 100 people that we needed. We made the barriers super low. As we grow, we're having to kind of do a little bit more as more and more farmers come online, making sure, produce safety and those kinds of things. We're working through all that kind of stuff. We did so much to support them, especially initially to scale, because many of these farmers weren't cultivating their full land. Just obviously, a quarter acre of vegetables grows a
It's a
lot
lot.
of
Yeah.
vegetables, which
Yeah.
is great for us. But we worked very closely. Some of these key partners were the conservation districts and the conservation commission, who really care about conservation, care about regenerative ag, and they really came in and stepped in and helped these farmers. We also worked in tandem with them, with the NRCS and the USDA, to help them access and get funded for things like high tunnels, which we really needed to be able to extend seasonality We do have cold and very hot here in Tulsa, in Oklahoma, and wind and all the different all the different weather. Right now we've had an insane amount of rain, so it's very challenging. We have gone into Oklahoma City, actually has a lot of great regenerative growers, and then not too far off in western Arkansas, there's some great food hubs that have great growers in those areas. So we really haven't gone outside of a 200-mile radius, and as we've grown, we've become more concentrated where we have to go outside of the Tulsa County area less and less. And as
Mm-hmm.
these farmers locally have grown, and what's really exciting is we've started to really build a local food system with both conventional and regenerative ag. And we could actually serve about 1,000 people today through our local food system in a food as medicine program. So we're excited to know the farmers have outscaled us, which may change later, but it's a great problem to have. And that's been really exciting to watch, that there's more variety of fruits and vegetables available for even general community members because we've stimulated this production, and we've been able to, the farmers want to grow what people want, so they love the feedback, and they've done that. And that's just been, it's been an incredible experience, that the farmers have been as important to me as the patients because they're critical to our success.
Yeah. Well, and I think it's great to remind people that there are resources out there to help you get started. You know, the High Tunnel
Mm-hmm.
program, there's other grants and other funding available through NRCS and other entities. So it's a great
There
way,
are.
to get started, because nobody can just walk in and say, "Oh, I'm going to be a 3,000 acre wheat farmer." The capital is just way too high unless
Mm-hmm.
you're coming back to a family operation. But to do this type of farming, it's very doable, very possible. And
Yeah.
yeah, we need more young people coming back uh, to want to be part of that system. And by giving them opportunities, you're really going to start moving the needle on that, and hopefully we see that spread. So from Fresh RX Tulsa, uh, how have you seen that spread to other areas of both Oklahoma and other parts of the country?
Yeah, that's been a really interesting process to see more and more people want to implement their own programs, or they want us to help them implement programs. We are actually starting a rural pilot in the poorest counties in Oklahoma next year. We're really excited about that. If we can do it there, I think we can do it anywhere. So it'll put us to the test, but we're really excited. There is a regenerative farm down there, which I again, I don't know how that happened, but we are very blessed that we'll be able to tap into that resource down there. We are hoping to expand Oklahoma City as well, but I've helped some other organizations like Think Regeneration implement a food as medicine program in Southern Illinois. I oversee an NIH food as medicine program in the Mississippi Delta on the advisory committee of that. And then what's been really exciting is Zuzana Solinsky in the Netherlands started the first clinical trial of regenerative ag and food as medicine in the Netherlands based off of a lot of the modeling of our program. And so, really, the thirst is everywhere. I spoke in the middle of nowhere in western Kansas in a town of 3,000 people, and the hospital there had a food as medicine program, and they had a restaurant there that sourced a bunch of local food. So,
That's amazing.
it's
Yeah.
it's endless. It's endless. And there's people all over the world. People have called us. People in Australia, people in India, people in Austria. This is needed everywhere. People are facing these similar issues everywhere. The context may be a little bit different, but the need is great. And so this could go all sorts of ways, and we're just excited to
Yeah.
see it grow like wildfire.
Well, I predict a very busy future for you, Aaron, as you move forward. And speaking of that, you and I were recently together. Green Cover kind of hosted a kind of a high level
Hmm.
Make America Healthy Again summit out in Ohio, and you were one of the folks there. And we had medical professionals there, we had farmers there, we had consultants there, we had policy people there. So it was a great way for everybody to
It's
share
amazing.
perspectives and ideas. And part of what came out of that is you recently made a trip to Washington D.C. as a direct result of that. Tell us a little bit about that, and what's going on, with with this current administration and why they're interested in what you're doing.
Yeah, it was a really wonderful event that you all hosted at the Culinary Vegetable Institute with Bob
Which
Jones and
by the
all.
way, what an incredible place that was,
Oh
right?
my, I mean, amazing, mind-blowing. It was such a beautiful place to do this convening and to be with like-minded, amazing,
Mhm.
passionate people. And we got to, Callie Means had called in also with Jimmy Emmons, our good friend, who's now the assistant chief of the NRCS, and we got to start talking to them about the benefits of food as medicine and also for regenerative agriculture. And I did get to go to Washington, D.C. and go by the West Wing of the White House and meet with Callie. We had several conversations in between there about different ideas and what's happening in the food as medicine space. And we had lots of different conversations about why hospitals would care about this. Don't they want to make money off sick people? And actually, hospitals are not making money off these, particularly these certain sick people. They're not actually built for chronic disease. They're built for more emergency medicine.
Yeah.
And so they want to do this. So we got to clear up and discuss some of these barriers. And that the Maha report will come out with a secondary report and helping to advise kind of action steps that can be incorporated there. So had a great conversation with Callie, going to continue to work with him. We got to meet with the chairman of the Maha caucus as well. And they actually want us to come testify with a regenerative farmer, our doctor, a patient, and myself, hopefully sometime in September. And we're hoping most of these groups are talking about a fund that Barack Obama actually set up for Centers for Medicare and Medicaid Innovation Fund. And it's really to use that fund to demonstrate innovation in the Medicare and Medicaid space. And so Callie is helping to recommend that we do a national food as medicine demonstration so they can measure these impacts on a scale, a larger scale, and hoping that happens. We also got to meet with HHS, Health and Human Services, and meeting with some special advisors to Robert Kennedy and mentioned the same thing. They're really excited about these new nutrition guidelines that are coming out. Our food pyramid is really the recipe for diabetes. And so really changing that and making sure there's not special interests involved and making sure people know at least the main guidelines. That's not necessarily funding to do demonstrations, but at least set some precedent. And we're really excited to see some of the changes that will come. Obviously, RFK has taken some bad chemicals out of bad foods, but we want to see some of those good foods funded. And I think that's coming. And we're really excited that he ended up, while I was in DC, fortunately and unfortunately, he did make a visit to Oklahoma City. I didn't get to see him, but they did have a Making Oklahoma Healthy Again event. And so that's pretty exciting that he visited. And we're really excited to implement the food as medicine bill, but hopefully something nationally can come because once Medicaid in certain states start doing stuff, the holy grail is really getting it integrated into Medicare, which is where a lot of people are insured through that are older adults, and where these costly costs are coming from. And so they are particularly excited about food as medicine. This administration, it's very much aligned, and I have heard from other healthcare lobbyists and professionals in DC that they actually haven't seen an alignment like this ever in the last
Yeah.
30 years. They said kind of there was some alignment with Obamacare and marketplace care and that kind of stuff, but nothing close to
Yeah.
this. And
This is
so
pretty
we're going to
radical.
pretty radical. Yeah. And something, on our food as medicine bill in Oklahoma, we had 5 unanimous votes on that bill. So something we actually could all agree on, which we desperately need. And so
That's
I'm just
where.
trying to enjoy yeah, so rare. And we've been just so incredibly additionally divided, I think, than even 20 years ago. And so just really excited there's an alignment. And I'm going to just try to drive it home as much as I can with a lot of help.
Well, that's just super exciting to see. Like I say, all these stars are aligning, and I think there's a lot of hope for the future for that. And I do want to talk just a little bit about the future. Do you see, because this is a question I wanted to ask you in Ohio, but we never got the chance. Do you see these food as medicine, fresh RX type programs expanding to include regeneratively grown grains and grass fed proteins? And, do you see it expanding beyond just fruits and vegetables to include, a lot more of the overall diet?
Absolutely. And there are kind of three different sections of food as medicine. There's produce prescription, which is predominantly fruits and vegetables. There's something
Okay.
called medically tailored grocery that a lot of people really haven't tapped into yet. And we're hoping to actually expand into that space. And that would include dairy, protein, and things of that nature. And then there's something called medically tailored meals, which has a lot of room for improvement in regenerative ag. Those are really mass produced, kind of like Meals on Wheels. And so there's a lot of room, I think, for growth there. And so a medically tailored meal is just a pre made meal that would be associated with appropriate for different chronic diseases. There's a great group in Boston called Community Servings, and they actually do a lot of local sourcing. I'm imagining some of those farmers probably use regenerative practices, and they make incredible meals, and they can do up to like 15 different arrangements of food based on different like allergies and chronic diseases. Is really impressive. But there's a
Hmm.
lot of room for different types of growers or ranchers to get inside of these spaces, and I'm excited. There's a lot of groups doing more research on why local and regenerative may improve these outcomes, not only just maybe the health outcomes, but maybe compliance. Because you mentioned earlier the taste of the food. Uh,
Yeah.
you don't, eating a vegetable from McDonald's is disgusting. No wonder no one likes vegetables. But those aren't vegetables. Yeah,
Yeah.
you don't.
No, not
So
really.
no,
Yeah.
no. So yeah, I think there's lots of space. A lot of regenerative protein growers have reached out, really wanting to be a part of this. And so I'm trying to figure out ways to expand in those areas and include more growers because there's just
Yeah.
so many ways they could participate.
Yeah, and hopefully, as the general public sees the success of these programs, that it will click in their heads that, oh, you know what? If this is good for 6 people,
Hmm.
this will probably be good to keep me from getting
Exactly.
sick. So I should be
Exactly.
looking for that food myself and,
Yes.
utilize, my own spending power to source this. I mean, that's the hope, that's
Yes.
the goal, and then we really see it start to grow and expand.
Absolutely.
So what one last kind of topic of questions that I'm curious about is, do you see this type of movement encouraging and incentivizing more people to grow some of their own food? Do you see a kind of a resurgence in a home garden type thing? Or do you see or find that maybe being possible? And what can we do to try to encourage that?
Yeah, I do think that's possible. That's a topic that's brought up to us. We do some different type of herb potting classes, and if people have particular interests, we connect them to those resources. I don't think everyone wants to do that, or it's not amenable to their lifestyle. But
Mhm.
yes, I do see that is really to a lot of people the ultimate goal is really being self-sufficient, knowing where your food came from and being able to grow it. And with kids, I think it's really impactful. We partner on a childhood obesity program, and they're teaching the kids how to grow, how to cook, and what nutrition is.
Yeah,
And I think it's
huge
incredibly
support.
empowering. And they've actually said there's a really cool statistic. They say a grocery store doesn't necessarily fix a food desert or improve health necessarily, but one visit to a community garden as a child can actually
Mm.
change the trajectory of a kiddo. And so, even if someone doesn't grow into an adult who's growing all their food, that's fine. But exposure to that, I think, is critical. And the kids are more likely to eat it when they had some part in growing it.
100%.
Yeah.
100%. Yeah.
So I do think
And
that's a part of this movement. I think we're seeing a resurgence of those victory gardens that were really well known
yeah.
in during World War II. Jacqueline Capriati is working on some of that movement nationally, and kind of in the Maha Trail. And so I hope people do. I'm moved to do it. I'm moved to do it too.
Yeah, well, yes, so am I. And so my wife and I we decided one of the ways we want to invest our money, we're building a greenhouse, one of the greenhouse in the
Yay.
snow type deals. So we
Yes.
can run it
Yes.
365 days a year, hopefully be able to have citrus trees in there. Now, right
Yes.
now it's just a hole in the ground. So I got a lot of work to do. But that's what we want. That's where we want to
Yeah.
spend our time and money growing food for our family, for our employees here at Green Cover, and just hopefully encourage and incentivize other folks to do that. And I was just at the Nebraska Soil and Water Conservation Society meeting and met a couple from Lincoln who, in this block of Lincoln, that I remember my wife used to live there, and it was a rough neighborhood.
Mhm.
They've got like 20 community gardens now, or 20 different people growing
Wow.
gardens just in this one block, one single block, because
Hmm.
they've really pushed it. And you know what they said? They said the biggest thing that we grow is community. Because they said
Yes.
before we started doing this, because they've lived there like 40 some years,
Mm.
we only knew like three people. Now we know everybody. We know everybody
Wow.
because, and they've just transformed that community. They've increased property values exponentially because they've cleaned up the neighborhood, and they're growing
Hmm.
food as a community. That's just such a great story. I mean, we need that in on every block.
Yeah, food absolutely connects us all, and that it's a beautiful to me, that's how I see Fresh RX too, is that food is this entry point to deeper healing and connection. And so it's just my Trojan horse actually to community,
To
to
sneak in
restoring
there, yeah.
community. Yeah, it's just to connect us, and it really does. Lincoln has some great initiatives. Nebraska's hot on the trail. I think Kansas might be next, and Nebraska's following. So really excited to continue to support efforts there as well.
Yeah, well, as a true red Cornhusker, it's a little hard for me to know we're trailing Oklahoma and Kansas in these things,
Yeah,
but
I
that's
know, but
okay.
give us one thing. We just have one thing, you know. But the greenhouse in the snow, I got to go to Alliance and tour the original one and
Yeah, we did
the
too. We
newer
did too.
one. And yeah, that
Incredible.
is so cool that you all are doing that. I can't wait to hear more about your journey doing that. And I want to build one of those too. That it's so
Well,
cool.
and so here's the other cool thing, like in Kearney, there's a church that put one up, and they're using that to minister to their community, and we'd love to do that at our own church eventually. I got to get mine built before I can try to push into that. But
Yeah.
what better way to serve and reach out to your community than
Yeah.
to help them grow food and help them understand how important that food is? So, yeah, very
Yes.
exciting. Any last closing comments, Erin? If people want to get involved, how can they? I'm
Mhm.
assuming you probably have a website for Fresh RX and maybe even the Food is Medicine. How can people learn more?
Yeah, absolutely. FreshRxOK.org is our website for FreshRx, FreshRxOK.org. We also have a YouTube channel that has all of our cooking and nutrition classes and some stress management classes on there. So that's available for anyone that wants to learn. We also just launched all of our recipes on our website as well. So there's a tab on there for recipes. You can really learn a lot about us from the website and our YouTube channel. If you're looking and interested in starting your own food as medicine program, I also have a food as medicine guide that I created on my website, erinwmartin.com. A lot of people get inspired from these podcasts and want to get a 30-minute call. And if I took every 30-minute call, I wouldn't actually work.
Yeah.
But I do have that guide on there, and there's other options to interact with me to help you. I offer technical assistance, I do speaking, I could do workshops and trainings, and happy to point you in the right direction or connect you with resources. There's also lots of free resources out there. Gretchen Swanson Center for Nutrition in Omaha has a ton of
Hmm.
resources. They're also called the Nutrition Incentive Hub. They have a few names, so you can find them somehow.
Okay.
Incredible resources on how to start a program, and just really encourage you to have a relationship with your local farmer. I know a lot of farmers are probably listening to this, but maybe you don't grow food, but find someone you can have a relationship with. And I've been ordering from organic regenerative farms as well, just for personal use. Alexander Family Farm, just super excited.
Oh,
I can actually eat their yogurt as someone who's had to
best
be
dairy
lactose
ever.
free.
Yeah.
Best ever. They pointed me in the direction of Burroughs Family Farm that does regenerative
Mhm.
olive oil and almond butter. So if you are fortunate to have money, vote with your dollars. Do it at the farmers market. Subscribe to a CSA. And be an example of your own health. You can't really fix other people, but you can work on yourself. Yeah.
Yeah, that's a great point. So thank you so much, Erin. Thank you not only for this conversation, but thank you for all that you're doing to advance this movement, and thank you for being willing to sacrifice your time to go to DC and speak up, for us. It's important, and it is the time when things are changing and moving. So, folks, thank you for listening to this episode of the Green Cover Podcast. We encourage you to take advantage of some of those resources that Erin shared, learn more, and take control of your own health and that of your family. Thank you so much. My brother and I started Green Cover in 2009 because we understand what it's like to be a farmer starting out on the journey to improve soil health. We saw the power of plant and biological diversity on our own farm here in Nebraska, but we found that it was difficult to get the right cover crop seed mix. We also learned that there was a big learning curve in successfully implementing cover crops. That's why we built Green Cover, so that farmers like you can access the highest quality cover crop seed put into the right diverse mixes, along with the technical advice and the educational resources to help you successfully implement cover crops on your own operation. So contact us today and we'll help you with the right cover crop mix for your farm or ranch so you can regenerate your portion of God's creation for future generations.